What accelerated your clinical development the most in the early years of your clinical practice?
Well, in the beginning, when I started working and when I started practicing, I feel like focusing on one thing at a time really made a difference for me. When I was focused on one skill, on one thing that I wanted to really excel at, to the next thing. Since I started working, the injectables was my biggest passion. Even before it was as big as it is right now, it was complete revelation for me to be able to do something, to change somebody's face, to accentuate something, to reduce something just with using injectables. When I saw that, I was extremely interested in it, and I was really trying to be as best as I could in that. So yeah, injectables was my first love and still is.
From this perspective, what are the most common mistakes you see early injectors making in the beginning of their career?
Well, few mistakes is what I see. First is I feel like younger colleagues start to do a lot of things at the same time, and they're not focusing on excelling at one thing. They try to do a lot and they try to do everything that they think of, and I don't think that's maybe the best approach. Second, I feel a lot of colleagues are maybe overly confident with their abilities. So I feel like trying to, in a way, being a harsh critic for yourself and trying to stay humble is very important, and trying to learn something new each day and each time that you have an opportunity to is very important. So I feel like focus and staying humble is maybe the good approach to try to be good at some point.
Now, being an educator and someone who has a lot of contact with younger aesthetic practitioners and injectors, which skill do you think is the most underestimated?
Well, by far, I feel like the most underestimated is the skill of assessment. I feel like that's what most of young injectors are lacking. That's also something that is extremely hard to learn, because it also depends on what your innate perspective and your eye and what you see and what maybe somebody else cannot see and that what can really give you an edge when it comes to having a big impact on the result of your patients. I feel like that's something that the younger colleagues should be focused on.
How has your approach to patient assessment evolved over the time?
Well, it definitely did evolve. It didn't change fundamentally, because from the start, I always try to look at the patient's face as a whole and trying to see what will have a biggest impact on the face, regardless of maybe what the patient expressed that he or she wants. I always try to give them what they need. So but definitely the way that I assess and the way that I see things are, of course, much more detailed than it was before. And also I'm much more confident in recommending the patient treatments or procedures that I think would benefit them, regardless of what they actually express their initial motivation for the treatment is.
Which treatments do you perform most frequently today, and how has that changed compared with a few years ago?
Well, I still do most of injectable treatments. I do a lot of devices. I do a lot of lasers, energy-based devices, and different procedures. But still, injectables is, I feel like, number one. So toxin and hyaluronic acid and biostimulators are definitely what I do the most. And of course, I do a lot more than I did a few years ago, so it did change in the terms of numbers.
What has been the most important for your development as an educator and trainer?
Well, definitely opportunities to witness how other people do it. So being a part of different trainings, different congresses, different education platforms, part of training for the companies, and being able to take part in, definitely that was what made a difference. And of course, having a desire and really trying to move in that particular direction, because it is a different path than just being a great skilled injector or great clinician.
What advice would you give to the clinicians who aspire to become educators in the future?
Try to see what sets you apart from other people, to try to be excellent at what you do and what you want to teach, because in order to teach you need to be excellent at what you do, and you also need to have a lot of experience in what you do. So it cannot be done in overnight. It needs to take time, because you need to build your credibility throughout that process, and you need to really go step by step.
What you are currently learning, improving and focusing on in your practice?
Well, I try to improve my soft skills of presenting and skills of how to have a clinical presentation and how to present at the Congress. So that's something that I'm focused on. And of course, about day-to-day working with the patients, actually improving every skill that's needed for me working as a patient, because first of all, I'm a clinician and I work with patients every day. So that's something that's the most important, that my patients have and get the great care that they need.